So how does one become an ER physician, and how do you get into the profession? If you are a graduate, an MBBS graduate, who's registered with the medical council, the state medical council, or the MCI, if you're an MBBS graduate, then you have various programs and academic opportunities to get into emergency medicine. Now, I'm not talking about the US boards. Let me talk about India perspective first. In India, if you have to become an emergency physician, you have various opportunities, starting with the formal postgraduate specialty programs that we have in our country. When I say formal, I mean the MD and the DNB programs. Both MCIs run MD and the MBs run DNB program. They do have now emergency medicine as one of their specialties. So you could write your NEET PG entrance. We've recently concluded one NEET PG and the results are out. I'm sure a lot of you might have attempted it. So you can get into those MD emergency medicine or DNB emergency medicine programs, but the number of seats available across the country are very, very minimal when we compare to the number of ER rooms we have in the country today. I'm not even talking about the need of how many ERs we need, but for the existing number of emergency rooms we have in hospitals today also, do we have enough formally trained emergency physicians is the question that I'm asking. And I don't think we have enough trained workforce, and we do not have enough seats there. But yes, that is your option. One option, you can try the NEET PG and get into a formal program. Or we have, I'd like to talk about other programs that we have. One is our own program, which I will eventually go on to talk about, our own fellowship in emergency medicine, which is one of the oldest standing emergency medicine training programs in India. This was started 19 years ago, almost in 2001. At the Apollo Hospitals group, where in emergency medicine for the first time saw an ER room. Apollo was the first to bring the concept of ER room into India, and a formal program in order to train their own physicians to run these ERs was designed then. That's the same program that we are talking about today also. So this is FEM, our own program, which has a legacy of 19 years. This is one of the programs that one can look at. There are other programs. One of the questions that the students have posted is about MEM, is a program run by SEMI, an organization, a professional organization of emergency physicians. That is a 3-year program that they have. A lot of CMC Vellore also runs an accident and emergency program under CMC blanket. That's another program that you can talk about. Apart from these, there are other programs run by individual universities outside India. Some of them can be taken here. For example, MRChem is one thing, the Royal College of Emergency Medicine's 5-year consolidated residency program, wherein you are taking a qualification exam of MChem, is one option, which has recently come into India as well. There is a George Washington University's emergency program that quite a few people do. So there are a lot of different individually university-run programs. And like CMC Vellore runs its own A&E, Accident and Emergency Program, a lot of hospitals also do their own trainings and programs and those. So one can look at those as well. So these are the various programs that you have in our country if you want to become an ER physician. But how do you go about with it? You could be a graduate of MBBS. Then once you're registered, probably you can pick one of these programs. Formal education programs like MD and DNB, surely through NEET. Otherwise, programs like ours, you can get interviewed and then enrolled on the program, and then finish your program and then get certified and start working in an ER department. And that's what our alumni have been doing for the past 19 years. And you can also continue to, further continue the emergency medicine education. You don't have to start with, stop with a single program. So when I talk about FEM, our program, I'll also talk about some of the journey of some of our students also. So this is how you become an ER physician. But I think more than the availability of various programs, what is important is to identify and understand and realize if you are really passionate about this department and specialty, because like I said, it may not be for everybody because it's highly demanding. When I say highly demanding, because of the kind of atmosphere you would be working in, I think one needs to analyze if am I suited for this, or am I ready for this, or is this what I want to do? That is one thing. Two, having said that, another interesting angle to look at is this is one of those specialties where your working shifts are predetermined, they're defined. Unlike a consultant who admits a patient, if I'm an internal medicine consultant and I've admitted a patient in the ward, then I'm on call as long as the patient is still there in the hospital. Unlike that, emergency, most of our hospitals where our students work and our consultants work, the shifts are designated and defined. So you're there for a shift for 8 hours, 10 hours, whatever the shift is, and then you're off. So that allows you more flexibility to plan your schedules for rest of your activities as well, like family or other things, whatever you want to talk about. So yeah.
Ma'am, what are the career opportunities which these physicians can have?
Like I said, the landscape in India for emergency has taken a shift in the last decade. The shift, what I'm talking about is earlier, the ER rooms, so-called casualties, were manned by anybody and everybody as a physician there too, because there was no formal training and there were no formally trained clinicians in emergency. Today, if you look at our hospitals, I'm talking mostly about the private sector here. The ER rooms are now being manned by formally trained ER physicians. So a new hospital, if I'm hiring for my ER room for my hospital, I would want to now employ a formally trained clinician in emergency medicine. I want the clinician to have learned and trained the protocols of emergency medicine through a formal education system, which could be any of those different things that I spoke about. So what kind of career opportunities they have is unlimited today, I would say. The reason I say that, there is a huge gap between the number of ER rooms we have in our country and the number of clinicians we have to support them. That is one. Two, the healthcare sector in India is growing at a CAGR of a continued annual growth rate of about 23%. Now that's huge, which means there are newer hospitals coming up, bigger hospitals coming up, which means there are going to be more ER rooms coming up, which means there is need for trained workforce. So the opportunities are only going to increase, because as health sector investments increase, today we see a lot of third-party investors from across coming in and investing in our hospitals today, and they are growing. Smaller chains are becoming, bigger chains of hospitals, and we are seeing multi-specialty hospitals in 2-tier and 3-tier cities come up, more than ever before. So definitely there are greater opportunities. If you are a formally trained physician in emergency medicine, there's always that edge that you would have, that you've been trained in that program. So career opportunities are huge. The pay scales are great, especially in the 2-tier and 3-tier cities where the need is so much more. They are looking for manned workforce. We keep asked all the time to send students across and to send residents across to their hospitals in their 2-tier, 3-tier cities, because they are struggling to find trained workforce. So definitely the opportunities are great. You can build your career path. Like I said, there is no end to learning. Obviously, you can start with one program and build on it. Pick up another program or a specialization or a certification around it. There are a lot of certifications by institutions like AHA and other emergency-focused organizations who do give out a lot of BLS, ALS, toxicology, pediatric ER, and different kinds of certifications, and you can update them. So you can continue to learn and grow in your career path as well. And this is one program or career specialty wherein you can see yourself as a consultant in the future. So yeah, career opportunities look good.
So it means to tackle all these millions of cases that's recorded across India these days, there is an urgent need for these physicians, emergency physicians right now.
Absolutely. Like I said, if we have to look at the statistics, I think the difference today, the gap we have for trained physicians, and we are talking about emergency medicine today, but if I have to talk about generally for a lot of these core specialties that we can talk about, there is a huge gap in trained workforce. If you have to talk about diabetes also, it applies, and for primary care, family medicine, it applies, and of course, since we're talking about emergency medicine today, it definitely applies. And the government has recognized these training gaps, and the NMC, the National Medical Commission that has come up, is looking into how to build on these competencies in graduate doctors so that they can take care of these training gaps that they're seeing. That is why there is a competency-based training that is now being included in the undergraduate curriculum, wherein it did not exist before, because our graduates are coming out, but there is a competency gap, there is a skill gap, and our postgraduate seats are not enough to bring in so many specialists right now today into the healthcare market to cater to the masses. So there is definitely need, and there is definitely scope. And I am not speaking from theory. I'm speaking from experience, because we have seen about more than 700-800 ER doctors graduate from our program across the last couple of years, and I've seen how their journey has been and how the requirement has come up to us, incoming requests from the hospitals to initiate these programs. So there is definitely need, and yeah, it applies.